Well, their story, their accounts, what everyone has done to ensure that we achieve this feat will definitely have its pride of place in history. But we're continuing our focus on this particular matter. We're joined now by Nomad Balogun, who is a public health personnel. Thank you for coming on this morning.
My pleasure. Good morning.
You know, to some extent, I mean, some may heave a sigh of relief that finally we have attained this status, but at the same time, they say the reward for success is more work, and
yes.
So we have to be on our guard, the minister and everybody has said. But when you heard this, you must have also been elated. But as a public health personnel, what went through your mind when you got that news?
Okay, for me, I think the very first thing is, for the first time in many years, I was really happy to be a Nigerian. As in, I put it in my Facebook page and I put it there that, everybody, thank you all for just making this to work. I'm happy to be a Nigerian. I'm happy that for once we decided to solve our problem. This particular problem, we came together to solve it, and it worked. And based on that, the only thing it has given to me is hope. Hope and more hope. That definitely, since we can win this Ebola war, then we can win a lot of public health issues. The idea about maternal mortality, child mortality, so many issues on domestic violence, so many issues on when you talk of poor sanitation, when you talk of how do you take care of the slum communities, underserved communities. I think of it and I think of it that, well, if that political will is there, if that commitment is there, and if people, the stakeholders, are ready to come together to work collaboratively, then indeed we can. Because definitely we did it, and I'm sure we can.
I think that from that particular report we just saw put together by Mary, I realized that we don't have depth of professionals in some sectors. From what we saw at the First Consultant Hospital, it was a fantastic move. And we also saw a collaboration from the state government before the federal government swiftly moved in. So I'm trying to look at that synergy between a public health institution and even the private health institution, and we were able to see some kind of collaboration and cooperation between these two. And as a public health personnel, is there a way we can actually help, sustain that kind of collaboration and cooperation irrespective of what you do and what I do as a government or as an individual or private entity?
Well, I think that what has happened with Ebola is something that has probably never happened in a long time in Nigeria. Now, for me, I see it as, in the euphoria of when we've won the Ebola war, one lesson that I actually thought of is the fact that by the time we are talking of social capital, now by social capital I mean the idea of all the stakeholders coming together to work collaboratively in an atmosphere of trust in reaching a particular goal, a common goal, was what happened with Ebola. Now, for the first time, for me, in public health, I actually saw a multi-sectoral approach towards combating a problem. Now, what do I mean by this? We have the medical, let's use the health professionals, the virologists, the social workers, the health educators, the medical, the public health physicians, the clinical physicians, everybody coming together to say, now, this is not enemy, this is not Jesu. We are together in this. Ebola can affect anybody, can affect me, can affect you. And you saw people bringing out their skills, and it worked. The very first thing that got to me was when the idea of that request for a ZMAP was rejected. And then I told myself, how are we going to do this? That is simply because I also had the mindset of the way it is, somebody has to help us from somewhere. But we were able to show the world that indeed Nigeria with its local skills, Nigeria with its own human resources, we can actually achieve a great deal. And then when I saw at the declaration of Nigeria being an Ebola-free country, I saw the WHO country director talking, I saw the CDC representative talking, and for once people could identify Nigeria with success. For once we could say, Nigeria has a robust health system compared to other countries in Africa. And for that, I think what we need basically is that mindset to be able to decide to do things irrespective of associations, irrespective of affiliations.
I'm also looking at the people here because that is the Nigerian people, because
Yes.
what we witnessed was a rigorous and relentless move towards contact tracing.
Yeah.
Whoever came in contact with this person, primary contact, secondary contact, and we were on it. We never dropped the ball. How did we manage all of that to the extent that everyone volunteered and almost everyone could even bring themselves out?
Well, for perhaps one area of community development now, looking at health, poverty, and everything that's actually that I am really very passionate about is about social marketing. Now, for me, I've always seen that what is really lacking in the Nigerian health system is that social marketing. It probably, the way they say it, you don't advertise the hospitals, you don't do this, Maybe that was what actually distorted the mindset. Many times we don't have a good social marketing with health. Now look at the way Ebola came in. Ebola came in with his own social marketing. Ready or not, here I come. So everywhere Ebola is going, whether you're ready or you're not, Ebola comes in and you just have to respond to it. Now Ebola came into Nigeria, we were not prepared. But then it did come in, and for once, I could see a very swift response. Lagos State government, the federal government, individuals. So many people came up with a lot of things. And before you know it, I remember there was a time my 4-year-old boy would say, "Mommy, I should wash my hands so that I can't have Ebola." And then I told myself, if my 4-year-old son can understand that washing hands can actually prevent Ebola, that is the level of the extent to which that social marketing went. So it means that for us, really with access to information, especially with health, one thing that has been lacking is the fact that health is not marketed in a social way. Health is not marketed in a way where you see that if I'm healthy, then I'll be productive. If I'm productive, then I will contribute to national growth. If I contribute to national growth, then Nigeria would have a GDP that would eventually help me with my own per capita income. So that way, if you are able to translate health to wealth, you can see that really a healthy population is a wealthy population. And the population that has ill health is actually a population that is made of poverty. And so when we start to look at that, when we start to monetize, so to speak, the quality of life that we're living, the quality adjusted life years, and we can say, yes, I think when people have the good quality of life, they will be more productive. When they are more productive, they would be useful to national growth. When they are useful to national growth, then there won't be any issue of Boko Haram, kidnapping, and then we can start taking from health to community development. And we'll see that eventually when our communities are developed, we are the ones that are going to really, really enjoy it, because then the life expectancy will be better, the maternal and child indices will be reduced, and then you're talking of less vulnerable children, less children that are orphaned. You're talking of less husbands that are now widowers. And because this husband is going to affect his own productivity at work, we're talking of the young population that will probably grow up to become the old population. And so when we look at all this, it comes like, it's more like a circular thing. Everything just revolves around one another. And so when we take care of health, we're actually taking care of the wealth of our nation. So for me now, Ebola has been able to, one thing it has been able to do is to improve the image of Nigeria. Now people are coming in, trying to look at what we have done. People are developing a lot of things. I look at the likes of Professor Nasidi, I look at the likes of Professor Milabu. I think of the social media activist, Kola Bakare, that actually started the Ebola alert thing, and now so many people tweet on it. I was one of the volunteers for about 4 days, and I know that people were calling in from a lot of places. And I look at it and I'm like, I'm proud to be a Nigerian. If we can do this, then we can do it for many other things. And then I say, if indeed this social marketing works, because one major benefit you are going to get is that social capital. We trust the health system. One thing, like the contact tracing that you said, they were able to build trust in the minds of Nigerians, in the minds of the private clinics. So anybody that saw something that even looked like, okay, this person is ill, in malaria, somebody just wants to call to say, I think somebody has Ebola. That is the idea of social marketing. Everybody feels involved. Everybody participated. There was community ownership. we wanted to just salvage the situation. We wanted to help Nigeria. For once, people were proud to say, I want to help Nigeria. I want to do this. I want to make it work. And it did work.